Hi, I'm Dr. David Eisenhauer. I'm a board-certified and dual fellowship-trained orthopedic surgeon specializing in surgery of the hand, elbow, and shoulder. Today we will be performing a mini-open carpal tunnel release on a wide-awake patient. The advantages of wide-awake surgery are multiple. First of all, the patient does not get a tube down their throat. They don't get an IV or any sedating medication. Therefore, they don't lose the day sleeping or in an anesthesia fog. Additionally, there's the financial advantage to the patient of not needing the services of an anesthesiologist with wide-awake surgery. I numb the patient's hand myself in the pre-op holding area using lidocaine and a very small needle. Once the patient is anesthetized, they're brought into the operating room and their surgery is done truly wide awake. The patient is talking and interacting, they're telling jokes and listening to music. Some patients find this to be an almost fun or memorable experience, they tell me. So with that said, let's get going with this next patient's 10-minute carpal tunnel surgery and we'll get her on with her day. So I'm just drawing out my surgical incision site and we're going to test and make sure. Are you feeling any of this, Brenda?
No.
Good. Okay. One of the other advantages to wide-awake carpal tunnel surgery is with the lidocaine, there's epinephrine in it, and that constricts blood vessels and decreases bleeding at the time of surgery. We also put a tourniquet on the patient in case we need to use it, but typically this is a relatively bloodless surgery. Let me see this way. Brenda, are you comfortable? Okay. Got the black handle scissors and I've got the pickup. And I'll take a blunt Wheatlander in a minute. Just spreading through the subcutaneous tissue now. Brenda, and if this bothers you, me, going into detail, let me know, okay? Got a knife? This is the layer of palmar fascia. I have a bipolar pedal.
Shonda.
Knife.
Should be a single pedal.
Here's the palmaris brevis muscle, which we're bluntly sweeping off of the transverse carpal ligament, looking for any anomalous anatomy.
Is it plugged in?
15, please.
Yep.
What's up, Casey?
That is my cautery machine.
Is it bleeding too bad?
No, you've got drops of blood. So right now we're incising the carpal tunnel ligament, which is a very thick and bulky ligament in the roof of the carpal tunnel. Do you have a rag nail? And I'll take the knife back. Take a clean ray tack. Thank you. Knife. Brenda, you doing okay?
Yep.
So the distal part of the carpal tunnel has been released. We can see the median nerve right here and the depth of the wound. It's white and it has some blood vessels running on it. This is the nerve that is squeezed with carpal tunnel syndrome. This nerve gives feeling to these three fingers and the thumb side of the ring finger. It also makes a muscle in the thumb work. Okay, hold that for me if you would. So we're about 2/3 of the way done, Brenda. You're doing great. Okay. You can see how tight this tunnel is and how tight this ligament is. It just wants to pop open as soon as we touch it with a knife blade. I'll take a freer elevator.
Is it really bad?
It's really tight. It is very tight, yes. You'll feel some pressure here in the forearm, okay? Okay, I'll take a small Metz scissor. Yep. And that is a complete release. We stick this instrument in and feel and make sure that all fibers up top have been released. Just got a little bit of bleeding. Got a freer? Got a Ragno. And then we look distally, all fibers have been released. Here we can see the edges of the transverse carpal ligament, which again is the roof of the carpal tunnel. And right below that is the median nerve, which was under pressure. So essentially we took a very tight tunnel. By cutting the roof of it, we popped it open and made it a more capacious canal for more room for the median nerve. This takes the pressure off the nerve. Have some irrigation. Brenda, we're done. We're just going to put some stitches in.
Okay. That was easy.
It was easy. Okay. As you can see, no bleeding per se, and no tourniquet was ever utilized. Have the ruler. Just want to show that this is a nice small incision, about 1 inch. I'm just putting some stitches in the skin. And you will be in recovery before you know it.
Thank you.
All right, there we have the mini open, wide awake carpal tunnel surgery. Hey, how you feeling?
Good.
Everything
Thank
went
you.
fine?
Yes.
You've been in recovery for about 5 minutes now, and they've got your paperwork already ready to go, which is another one of the beauties of wide awake carpal tunnel surgery is you don't lose the day sleeping and in an anesthesia fog. So we'll get you out of here soon. So I just left the patient in the postoperative area. She's doing fine. That will conclude the video. If you need any additional information about carpal tunnel syndrome or carpal tunnel surgery or orthopedic surgery in general, please visit us at www.carpaltunnelconcierge.com or via our sister company, MoonlightOrtho.com, and orthopedic telemedicine practice, where you can be seen by an online, board-certified orthopedic surgeon and given a diagnosis and treatment recommendations typically within 24 hours. Thank you very much for watching.